Hello, my dear students. I welcome you for FMT recall session of the exam July 2025. There are about 10 questions from forensic medicine. Of course, some are overlapping. Now, coming to the first question. A doctor receives two summons, one to appear in court for a murder case. Murder case means it is a criminal case, and another to provide expert medical opinion in a negligence case. That means it is not his own negligence case. Somebody else's negligence case is going as an expert witness. Which of the following should the doctor prioritize? Now, you know very well what is to be done in case of a witness receive two summons to attend on the same day. Always, you should give first preference to the higher court. If both are of same level, always you should prefer to go for a criminal court. If both are either criminal or both are civil, then you have to attend whichever the summons you receive early. Okay. Now the question here is one is murder, another is expert opinion in a negligence case. Definitely, the first one is a criminal case. Second one, we don't know whether it is criminal or civil. If it's going in a civil negligence case, then definitely criminal you have to get preference. Even if it is a criminal case, but murder, the maximum punishment, the heinous crime. So your answer is A, preference in the murder case. Okay. Number two, a man was abducted from his home and was never found. His son now seeks to claim his father's property. According to Section 111 of Bharatiya Sakshya Adhiniyam or BSA 2023, how many years must pass before the son is entitled to claim the inheritance? Now, look here. What Section 111 of BSA says is burden of proving that the person is alive who has not been heard for 7 years. In other words, I tell in brief, if the whereabouts of a person is not heard for a minimum of 7 years, law presumes that he has been dead and his son can inherit the property. What 111 section of BSA says is when the question is whether a man is alive or dead, and if it is proved that he has not been heard of for 7 years by the people from whom he is normally to be heard, then the burden of proving that he is alive is shifted to the person of whom it. In other words, law presumes that a person is dead if his whereabouts is not known for more than 7 years, unless somebody has to prove that he is living. Okay. So now the answer is very, very straightforward. It is 7 years. Okay. Number three, identify the pathology in the image. Now here, what you have to see is the teardrop sign. The teardrop sign is seen in case of blowout fracture. Blowout fracture, as you see in the picture, it is the fracture of the inferior orbital wall. Inferior orbital wall. That is known as blowout fracture. How it is caused? It is caused by a blow by an object larger than the orbital aperture. Say, for example, if you take your palm and hit on the eye, there is sudden increase in the intraorbital pressure, or a cricket ball, or a football, or a basketball hit on the orbit. Then it may give rise to fracture of the inferior wall. The periorbital pad of fat may protrude, which may look like a teardrop known as teardrop sign. Now, same question has been asked in FMG May 22. Identify the fracture shown below, that is blowout fracture. And here again, the answer is blowout fracture. Very easy question. Okay. Four, a person suffered a crash injury from a falling building after a bomb blast. What type of bomb blast injury is this categorized as? Repeatedly, they ask about the bomb blast, not only in FMG, even in NEET as well as in INISET examination. Now, let me speak on bomb blast injuries in detail. Number one, primary blast injury. See, there are three types of blast injury. Number one, air blast. Number two, immersion blast. Number three, solid blast. Now, if I speak about the air blast injury, there are five categories. Number one, primary blast injury is always due to the shock wave, also known as blast wave. The shock wave usually affects the air-filled organs or cavities, especially the eardrum, number one, and number two, lung. Air blast means the bomb blast takes place in the open air. Immersion means in the water. Solid blast means the bomb blast takes place outside the building or inside the building and you sustain injury, that is solid blast. And I told you, by primary impact injury, most commonly involved organ is air-filled cavities or air-filled organs, especially the eardrum, number one. Number two, the lung. Where in case of immersion blast, it depends whether head is out of the water or head is inside the water. If head is out, most common organ involved is gastrointestinal tract, and if head is in, again, ear. In case of solid blast, most commonly involved organs are skeletal features, skeletal fracture, the bones, especially vertebrae as well as the leg bones like femur or even tibia or fibula. More the homogeneous, less the injury. For example, liver is more homogeneous, the chances of injury is less. In case of air blast injury, the most common organ to be damaged due to shock wave is, it is asked in FMGE, January 24, tympanic membrane not given. So next is lung. Most common organ involved in immersion blast in complete immersion, I told you the answer is tympanic membrane. In complete immersion, tympanic membrane. But if head is out, the most common is small intestine. And if at all the question never mention about whether head is out or head is in, majority of the time head is usually out of the water. So your answer should be small intestine. Okay. Two, secondary blast injury. Secondary blast injuries are due to the flying missiles. The flying missiles may be derived from the bomb itself, the content of the bomb, or if the bomb falls off the ground, the debris from the ground may come and hit the person and sustain injury. So remember, secondary blast injury is always due to flying missiles. See here, one nail has entered into the cranium. And here, three most common injuries are the combination of abrasion, bruises, and laceration, bruises or contusions, that is known as martial trad or body sling. The most common injuries are combination of abrasion, contusion, or bruises and laceration, known as martial trad. Which of these finding is not specific of blast injury? Asked in AIMS November 15, the first time they ask in AIMS, the answer is fracture. The muscle triad of abrasion, bruises, and lacerations is seen in which category of air blast injury? You know the answer, secondary blast injury. The triad of abrasions, bruises, and punctal lacerations seen in, again, asking in May 25, bomb blast injuries. Number three, tertiary blast injuries, and tertiary blast injuries are due to the blast wind. Blast wind, where the person is thrown away from where he is standing. Okay, and he may go and hit against a building or a tree or maybe on the ground and sustain injury. That is tertiary blast injury. Remember, tertiary blast injuries as a result of impact with the any other object. Any other object means maybe the object present on the ground like the tree or the building, or he falls on the ground itself is thrown in. A dead body was brought to the casualty with laceration wound over anterior chest wall and multiple abrasions of small laceration over abdominal wall. The injuries are due to flying missiles. Number four, quaternary blast injury. Quaternary blast injury means it is not categorized under primary, secondary, and tertiary injuries. Not categorized primary, secondary, or tertiary. Why it is due to? It may be due to the fire or toxic gases or crush injuries. Inhalation injury, the person may inhale the toxic gases, or always at the time of bomb rush, there will be flame. The flame may touch and cause burns. Okay. Any other exacerbation of existing condition, like because of the dust as well as because of the smoke or fume, the asthma may get exacerbated. Okay. And the broad category of blasting related harm that includes anything not directly caused by the initial blast wave or its immediate effects. Initially, or primary because of shock wave, secondary because of flying missiles, and tertiary because of blast wind. This is not directly related to the bomb blast, indirectly, maybe fall of building. Okay, look here, the flame, the fire. Along with that, there'll be toxic gases or falling of the building or machinery. Okay. So, number five, quinary blast injuries or later effects where these are the illnesses or injuries or diseases caused by chemical, biological, radical substances. For example, Nagasaki and Hiroshima atomic bomb, where a lot of complications later because of the radiological substance. Or if you use a chemical bomb or a biological bomb, then it is quinary blast injury. So now you got the answer here. The falling building after a bomb blast. It is not tertiary. I have seen some teachers are telling it is tertiary blast injury. It is not tertiary blast injury. It is quaternary blast injury. Number five, a bomb blast. If a person's eardrum ruptures, what type of blast injury is that? Again, same thing. The primary blast injury, most common injuries, the tympanic membrane, that is primary blast injury. Number six, person was found dead in a swimming pool. On autopsy, stomach and lungs were filled with water, and there was evidence of mucinous flow at the nose and mouth. What is the most likely mode of death? A very easy question, straightforward question. You know the answer is wet drowning, but now let me talk on classification of drowning. Number one, wet drowning, also known as classical drowning or typical drowning or primary drowning, where once the person falls into water, he inhale a lot of water into the lungs. Lungs get churned up with the mucus, especially due to violent respiratory efforts, which releases copious amount of white, fine, leathery froth, which gets filled in the alveoli and give rise to pulmonary edema, the condition known as emphysema osum or drowning lung. Typical drowning or wet drowning. You can see the enlarged lungs. Each lung may go even up to 2 kgs. At the same time, there will be a copious amount of white, fine, leathery froth oozing from the mouth, nostrils, even in the trachea, once a couple of trachea and larynx, you can see copious amount of white froth. Sometimes, if the alveoli ruptures, it can be bloody. Number two, submersion of an unconscious person. If an unconscious person falls into water, water will be inhaled into the lungs, but there is no proper violent respiratory effort because of the unconsciousness. Release of mucus will be there. Mucus gets mixed with the water, but minimal froth will be there. Definitely, there will be pulmonary edema, but minimal froth. This condition is known as edema cosum. That is the difference between emphysema cosum, copious amount of froth, here minimal froth. Number three, dry drowning. Absolutely no water in the lungs. As soon as person falls into water, water triggers the larynx and there will be laryngospasm. Absolutely no fraud. Number four, immersion syndrome, also known as hydrocation. Here, it is especially seen when a person falls into icy cold water or in case of cold water entering into the eardrums or water splashing over the epigastrium. Again, immediately person may die of vagal inhibition and cardiac arrest. Cardiac arrest and vagal inhibition. Again, again here there is no fraud. Most commonly seen in children and intoxicated people. Number five, secondary drowning or post-immersion syndrome, where the person dies after 24 hours is resuscitated from the water, but he dies after 24 hours due to complications, maybe like electrolyte imbalance or maybe aspiration pneumonitis, bronchopneumonia, but most common complication is post-hypoxic encephalopathy. Here again, there is no fraud. Okay. And near drowning means person does not die at all. Or you can say apparent drowning is about to die, but he does not die. The victim survives the drowning episode. Now the answer very clear. Stomach and lungs were filled with water because sometimes a person may drink, swallow the water which may be found in the stomach as well as intestine, upper intestine. Lot of water in the stomach and lungs, that is emphysema cosum or maybe edema cosum, we don't know. At the same time, there is mucinous froth from the nose and mouth. The answer is wet drowning. My 6 months old male infant is brought to the emergency department by his parents with complaints of lethargy and poor feeding. That means proper care has not been taken. On clinical examination, the child has bruises over the chest and abdomen and swelling around the knee joints. X-ray reveal multiple fractures of different stages of healing. That is very, very important. Multiple fractures are different stages of healing, including long bone fracture around the knees, posterior rib fractures, and subdural hematoma on neuroimaging. Based on the findings and the image provided, we don't know exactly what image was given, but X-ray showing some long bone fractures and rib fractures. What is the most likely diagnosis? Again, very, very easy. Definitely, it is a battered baby syndrome. But meantime, let me discuss on battered baby syndrome. Here, it is repetitive physical injuries as a result of non-accidental violence. There may be deprivation of love, care, affection, and nutrition, usually seen in a child below the age of 3 years, and mismatch between history and physical finding with multiple bruises of different colors, means different age of bruises, or even fractures of different ages. Okay, and here, look, same question. Similarly asked in NEET PG 2019, suggestion of a case of victim of battered baby syndrome is multiple injuries at different stages. Now, let me speak on fractures in BBS. Most common fracture is in the skull, where you get eggshell fracture because the surface area of the head is bigger in case of infant compared to body. As soon as the person is pushed, the head touches the ground and he may sustain eggshell fracture, which is the most common fracture. One of the method of battering the baby is shaking the baby, and once the person hold the baby under the armpit, you see here, the fingers come at the paravertebral area once it shakes thoroughly because of the pressure by the fingertips and finger pulse. There will be fracture maybe from first rib to 12th rib continuously. You can see in this picture multiple rib fracture. Okay, and these fractures are known as knobbing fractures because on healing, you can see multiple calluses. This knobbing fracture give rise to string of bead appearance. String of bead appearance. Multiple rib fracture. Okay. Meantime, there is long bone fractures. As you see in the question, there are multiple fractures in the legs. One of the method of battering the baby, shaking the baby, or the person shake the baby, it may give rise to bucket handle fracture and corner fracture. The bucket hand fracture means, look here, once you shake the dangling movement of the lower limbs, the time the metaphysis get avulsed from the diaphysis on X-ray, you can see bucket handle fracture. Meantime, bucket and fracture means avulsion of metaphysis. What about corner fracture? The medial and lateral collateral ligament pull the chip of the metaphysis. That is chip fracture of metaphysis. That's why it's known as corner fracture. All these fractures are seen in case of battered baby syndrome. Meantime, in shaken baby syndrome, one of the most common finding is subdural hemorrhage. In case of shaken baby syndrome is one of the method of battering the baby. I told there also may be subdural hemorrhage. So the answer is battered baby syndrome. Number 8. The patient is brought to the emergency department with signs suggestive of opioid poisoning. What is the antidote of choice? Question repeatedly they ask this question. All of you know the answer is naloxone. Then what about the naltrexone? Naltrexone used in alcohol use disorder as well as opioid use disorder. Atropine, generally forensic medicine, we say it is an antidote for organophosphorus poisoning. Flumazenil is antidote for benzodiazepines. So this is very easy question. Number 9, a deceased woman was sent for autopsy. She was found dead in a locked room with a heat stove still running. Cherry red discoloration of skin and mucus was found. What is the most likely cause of death? Of course, once you see the cherry red discoloration, then immediately you can say that it is a case of carbon monoxide poison. We may see how come heat stove can give rise to carbon monoxide poison depending on which type of heat stove. If it is electric stove, even if it is a locked room, there will be no release of carbon monoxide. Now I am showing a list. See, electric stove is a fuel, no. Risk of carbon monoxide, no. Safe indoor, yes. Whereas all other gas stove, kerosene stove, charcoal stove, wood stove, camping stove, any stove releases carbon monoxide, but with ventilation, gas stove and wood stove may not give rise to death of a person. Okay. At the same time, cherry red discoloration is due to the carboxyhemoglobin level. There, what you can see in this picture is cherry red discoloration of postmortem lividity. So answer is carbon monoxide poisoning. Okay. A young boy presents with history of ingestion of paint chips, leaves, and soil. A blood examination showed the following microscopic picture based on the clinical history, suspected environment, exposure, and peripheral smear. What is the most likely pathology? See, whenever you see lead, you should suspect. Sorry, whenever you see paint, you should suspect lead because paint contains lead. Children may suffer from chronic lead poisoning because of the licking the paint. Newly painted walls. At the same time, in peripheral picture, you can see multiple pinnet-sized blue drop in the RBC that is known as basophilic stippling. Okay, basophilic stippling. So basophilic stippling is also known as punctate basophilia, which may be seen in three poison: zinc, arsenic, and lead. You can remember ZAL. ZAL, it is due to the inhibition of pyrimidine 5 nucleotides. Okay. So now you got the answer. The answer is lead poisoning. Okay. Then regarding the recall of these 10 questions of FMG July 2025, be happy, make others happy, possible, grow gracefully, and dive it dignity. Okay. Bye bye.